Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, is it June? I think it's June, and what do we do in June? For 16 straight years on Pennsylvania Newsmakers, we talk about the never-ending debate over the Pennsylvania budget. We're going to hear from the Democratic side this week. Next week, we have Charles Zogby, the budget secretary, on to hear from the Governor Corbett's side. And then we have a little update from our friends with the Hospital Association of Pennsylvania. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, well, welcome back. Well, as usual, the host always gets something wrong. Hospital and Healthsystem Association. I don't want Scott Baker coming on here in a few minutes and saying, what did you do, or Scott Bishop, rather. We'll get this all right. Senator Rob Teplitz represents Dauphin and York counties. I got that right?
That's
See,
right.
I'm getting better at it. We're going to hear from, we'll get sort of the view of the Democratic side. The Senate Democrats passed a budget bill, or I should say they kicked the bill out. They want Teplitz is here to talk about it. We have, am I right, Senator, 3 different bills out there floating around right now?
There are 3 proposals. There's the governor's original budget proposal from February. The House Republicans are moving their own proposal through the process. But the Senate Democratic Caucus put out our own proposal earlier this week.
Okay. So we have 3 different proposals now. Let's go through look, this is going to affect almost every Pennsylvanian in one way or another. Would you agree with that?
Absolutely.
So it's important to talk about. Now, here's my take on this. 28.4 is your budget, 28.2 the governor, is that right? 28.1?
The difference between the Senate Democratic budget and the governor's budget, we would spend only about $50 million more than the governor, but we would do it differently.
That's where I'm heading. The point is, none of them call for new taxes, correct?
Right. We don't have any broad-based tax increases in our budget.
Okay. No broad-based taxes. So the difference lies in priorities.
That's right.
Okay. What would you do differently than, let's say, the governor's budget or the House Republican budget?
We have a couple of priorities: investing in public education, investing in job creation, protecting our communities, helping our smaller cities across the state deal with their financial problems. Those are probably the top 4, but we're able to invest in those by making smart decisions of how we can save and generate new revenue in order to pay for it.
Mm-hmm. So as I look at this, again, the big point, no broad-based taxes. Where do you stand on the business tax cuts? You know, without getting into the details of it, the capital stock and franchise tax, the corporate net income tax. Where does your budget stand on those?
Well, personally, I agree with the business community that we shouldn't have both a corporate net income tax, which taxes profits from business, and also the capital stock and franchise tax, which taxes assets. That's why the state over the last 15 years has been phasing out that capital stock and franchise tax. And I want to see it phased out because we shouldn't have it. What our budget does, like budgets in the past, is suspends the phase out for 1 year so that we can use those funds at a time when we need them to invest in some other priorities.
Yeah. The governor's budget, and I don't know about the House version, perhaps you do, is predicated on some revenue from the privatization of the state stores. Is that correct?
That's right.
If you don't do the privatization, and who knows, and we can talk about, I want to talk about transportation in the next segment. So we've got the House that says, let's do privatization of alcohol. The Senate says, let's do this big transportation funding. Not arguably, we need 1.8. You can make an argument up to $3.5 billion a year. You're nodding your head so far. I think I'm right. The governor's budget doesn't seem to make it without the monies from the privatization of alcohol. Is that correct?
Right. The governor's budget was based on a lot of premises that folks like me disagree with. Privatizing the liquor system, radical reforms to the pension system for teachers and other public employees, It doesn't include enough money for transportation, for roads and bridges, and so it really wasn't a good starting point. That's part of the reason why the House Republicans came up with their own plan and why the Senate Democrats came up with our own plan.
All right, let's go to the heart of the matter. Everybody wants to get this done. So, there are differences over, priorities, and that's not uncommon. Democrats tend to have slightly different priorities than Republicans because of the nature of the representation. But everybody wants to get this done by June 30. So you're moving at a snail's pace, not you in particular, and you've got all these big issues on a scale of 1 to 10, with 10 being the most optimistic. Where does Senator Rob Teplitz stand on how close you are to getting this done?
That's a great question. It has been very slow. It's frustrating as a new member because I came to get things done. My best prediction would be that we take it down to the wire with passing a budget, meaning the numbers document, but that we roll into July with some of the associated bills. I'm not defending that, but I think that's what's likely to happen.
All right, when we come back, I'm going to ask Senator Teplitz about the transportation bill and a couple of other matters. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. Terry Madonna here with Senator Rob Teplitz. We're talking about the state budget, whether it can get done, but importantly, a big trio of items, pensions, privatization of alcohol, and roads and bridges. Senator, I don't remember a time, unless they don't get the budget done, that the legislature hangs around in July and August. They're usually off doing other things. So that means putting it off till the fall with no deadline. What works, I think, is the deadline that forces you all up there in the Capitol to get this thing done by June 30. Maybe I'm wrong about that.
No, unfortunately, that's the way government seems to happen in the Capitol, is operating by crisis and deadline.
Yeah. All right, I got to go to the sort of the big issue of the moment. Almost every paper in the state, here's what it says. Senate passes transportation bill, sends it over to the House. House passes liquor privatization bill, sends it over to the Senate, and the two sides stare at each other. And I don't mean that meanly. I mean, you're just sort of staring at each other. And I know you're fairly new, but can this get done?
I think so. The difference between the liquor issue and the transportation issue is that there is overwhelming bipartisan support for doing a transportation bill.
Correct.
And so we need to focus on that. I was very proud to help support it. I co-sponsored the Senate bill. I think it's an important investment in our crumbling roads and bridges, an investment in public safety, an investment in job creation that will be seen here in this area visibly with projects. I think we have to do it.
And it's bipartisan. Democrats and Republicans support it. Whereas privatization, even Senate Republican leaders, and we've talked about this many times, on the privatization thing, seem more inclined to do what we call modernization. Meaning keep the system, maybe privatize some aspects of it, modernize some features of it, right?
Right. We have a plan to modernize the system. In fact, it generates $100 million extra that helps pay for some of our other priorities in the Senate Democratic budget. Longer store hours, allowing stores to be open on Sundays, greater selection, some more customer convenience issues, things that are important to address the public's concern, but without losing all the revenue that the system brings in now.
Yeah. I mean, I guess I'm back to the question I asked you on the budget. I mean, this is, you're now, as this show will air over this weekend around the state, I mean, you're looking at, what, 3 weeks maybe? You probably have up through the 4th before the press starts to count down the number of days that you don't have the budget done on time. But I mean, can this get done?
I think it can. I think we saw a huge move forward with a bipartisan transportation bill. We sent it over to the House. There's now going to be pressure on the House to deal with that. We're going to have to do a budget. I think that those two things are probably the most likely two things to happen. I don't see pension changes happening before the end of the month, nor should they. And I don't see liquor privatization happening, nor should it. So, you know, I think it could be a very positive month, but we've got to get people to roll their sleeves up and work.
All right, before I let you go, I have to ask you about the Reform Caucus that you and a Republican colleague actually from Lancaster County are created, formed. You have an agenda that I think a lot of voters support, and maybe I'm a little partial to it because I do think I have to be a little careful as a host, but there are some things that I think voters would like to get done. Is there any progress that you can report on any aspect of that?
Absolutely. We had a great first working meeting of the caucus. We had probably 20 or so legislators and staff there. And what we did at that meeting was try to talk about areas of consensus. What we should be working on.
What are the 3 or 4 things that you want to get done?
I think there's consensus around dealing with legislative COLAs, eliminating them so that we don't receive cost of living adjustments in the middle of our terms. There's a consensus that we have to do something about gifts, banning gifts, or at least lowering the threshold significantly so that they have to be reported.
Congress has a pretty strict rule on that. Go ahead.
And then the third one is redistricting reform. That was a very political process that dragged on far too long, and we have to make sure that it's the voters that choose their legislators and not the other way around.
Nothing on campaign finance reform. I mean, in our state, as you know, somebody can give Senator Teplitz any amount of money at any time, and you can use it for almost anything under the loose definition of, but I guess that's a tougher, you have to get priorities.
Sure, I mean, that was certainly discussed, lobbying reform, open records reform. There were a whole host of ideas that were discussed in terms of narrowing them down to the areas of consensus of manageable initiatives where we think we could actually make progress and get votes. Those are the couple that I see the consensus growing around.
All right, but as always, thanks for coming on. We're going to have Charles Zogby on. We'll hear from Governor Corbett's position on the budget next week. Coming up, however, we have Scott Bishop. Boy, we have Medicaid. I want to talk about public charity, a bill in the Senate that we need to talk about. We'll do that after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The State System is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, it's time for our healthcare update, and joining me is Scott Bishop. He's the Senior VP for State Legislative Services with the Hospital and Healthsystem Association. Scott Bishop, welcome.
Thank you.
All right, let's talk a little. I mean, I don't think there's a bigger question in this state right now, and it's been going on now since a certain Supreme Court decision that all of our viewers know about. Medicaid expansion, state by state. Each state gets to decide whether they want to do it or not. It's about 15 million people across the country. In our state, I've seen different figures who would be covered by Medicaid if the governor and the legislature sign on to it. 650,000, 850,000.
Yeah, we think it's another 350,000 more folks who'll be covered by Medicaid if they would expand it.
Okay, so there's a sizable number of people. The governor, has not signed on to it in brief. What are now in your organization is for the Medicaid expansion?
For Medicaid
right?
expansion.
Make your case.
So we know that it's been a tough issue for the governor. There's been a lot of unknowns, variables that he's tried to navigate through, some of the legislature as well. But what we've come down to is when you look at the economic side of it, you look at the public policy, healthcare side of it, it's the right thing for the Commonwealth to do. And we continue to press for expansion of Medicaid. All the economic studies, they talk about the jobs that are supported, in the tens of thousands. They talk about the positive economic benefit, not only just in tax revenues that are generated by expansion, but also just the impact in the gross domestic product of the Commonwealth. All positive economic drivers that go with the expansion, and we think that's
and some of the studies, and you correct me if I'm wrong, are done by people like the Pennsylvania Economy League. No one would ever call them a far-left organization. Right. The state's independent fiscal office, the Rand Health. I mean, these independent studies, you think are conclusive about the economic impact it would have on the state?
We do, and they're consistent. I mean, they range. I mean, the Rand study was on the conservative side of what the economic benefit can be, and it moves up from there. So, I mean, I think they try to take a concise look at both the economic driver side of it when we have a healthy hospital community on the economic side of things, as well as the taxes that are generated by the way that the process works and payments and all that kind of stuff.
All right. How the governor has, as you point out, he's met with Kathleen Sebelius, the responsible federal official that would, whose agency would oversee this. Yeah. Let's start there. Is there a time frame? I've not seen a kind of a specific time frame for when the governor has to buy into that decision.
There isn't, and that's, I mean, technically speaking, there isn't. I mean, but ultimately, the sooner we would expand, the sooner we start to experience the benefits. So for us, it's like, hey, we'd like to get as much benefit as quickly as possible, but, there isn't.
I want to move on to another subject, but his argument, and I've actually talked to him about it on the program, is that it's not this year or next year or even the following year, because the federal government will pay for it and reduce, but it's 10 years from now, what happens if all the costs shift? But I guess that's the nature of government anyway.
It is, and what we've tried to articulate is that even when you look at the total costs of expansion moving out into those out years, we still think the economic side of it covers it. The way taxes are generated, the economic drivers that would be a part of it will still cover those costs. But you're right. I mean, it's difficult looking out what the federal government promises to do now, what they may do later. It's fair concern. All
right, let's run to a break. There are a couple of other issues that I want to talk about before we end the program. One is an amendment to a purely public charity. What does all that mean? We heard an awful lot about nonprofits and what they can do and what they can't do in politics nationally. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. I'm chatting with Scott Bishop from the Hospital and Healthsystem Association. All right, before I get to this public charity thing, statewide quality care assessment. Oh gosh, my eyes just glazed over. It's something that the medical hospital community cares about. Explain it.
We do. It's basically the hospital tax. It's the way hospitals are partially funded. It's complicated, you're right. Eyes glaze over quickly. The basic premise is it's a way hospitals pay an assessment to the Commonwealth, and then that assessment is used to draw down federal matching funds, and that's basically the way hospitals are funded for Medicaid.
And what do you want?
Well, it's kind of a two-pronged process. Again, big part of it, draw down the federal funds, but there's a second part of the tax that goes to the general fund to help with the budget. We've been doing this now for 3 years.
Okay.
We view ourselves as partners with the Commonwealth to get us through these difficult years. But there's a push to take a little bit more from the hospitals than we support. We need to bring that number back towards a number that there's that equal balance of benefit to the Commonwealth, but we don't pull away from the hospitals.
All right, boy, purely public charity. You know where everybody's mind goes. As soon as this comes up, we're going to talk about the IRS and C3s and C4s. They're all confusing. What's the public charity aspect of this that is important to you?
Well, I mean, hospitals, a large part of what we do is charitable care.
You do charitable care, right.
And that's, when we look at what we do for communities across the Commonwealth, and we look at all the different things we do on a community benefit, more than $5 billion worth of different things. Charitable care,
profits
community
as well
building.
As non-profit hospitals.
Well, the numbers that we're able to collect are for the not-for-profit community.
Not-for-profit.
But investor-owned hospitals do the same thing.
Same thing.
When Medicaid patients present and they're doing the same thing.
You have to provide the care while they
provide
can pay
all the
for it
care,
or
do
not.
all that kind of stuff. So we do all of those kinds of things. Again, community building, research, health education services, all that kind of stuff. It's an important part of what the hospital mission is. And so the tax-exempt status that comes with being a purely public charity is kind of to help balance all those things that...
I got it. So you don't have to pay taxes before the services. What do you want out of the legislature?
Well, complicated issue. Last year, the Supreme Court, we have in place a statute that dictates, you know, if you say you're a purely public charity, you have to do these things.
Okay.
It's based on court decisions from the 80s, but you know, the legislation brings more clarity. Last year, the courts kind of reverted back to their 80s decision, kind of moved away from the state law, and it's created a sense of controversy and concern that they're going to be...
Are you suggesting that it's not quite sure now whether you come under the purely public charity law or not, and whether you're eligible for the tax exemption, and you want that clarified?
That's right. We want it clarified. So the Constitution already says to the legislature, you're allowed to exempt somebody from taxation. That power's there.
Okay.
We want to add a second prong of that, which says if you make that decision, then it should be the legislature that lays out the criteria for what
I got it. So you want the legislature to say, this is what you have to do to be a public charity.
Right.
I got that. Where does all this stand? Where does this stand?
We've had Senate Bill 4, sponsored by Mike Brubaker from Lancaster County. It's passed the Senate. It's moving in the House. It was reported out of the House Finance Committee this week.
So you're optimistic. It sounds like it's on the fast track.
Well, remember the constitutional amendment process is
you got to pass twice, and it's got to go.
For the first time, I think we feel optimistic we can get it through.
What we're saying is, if you want to amend amend the Constitution, you got to pass 2 sessions of the General Assembly, and then the voters of the state have to adopt it. But you ought to be optimistic about that, given the fact that it seems to be moving.
We are. It's moving, and we're proud of what hospitals contribute to the community in that.
All right. As always, thanks for watching this edition of Pennsylvania Newsmakers. We'll see you next week, and as always, stay well.